I'm excited to talk about these vaccines. It's a really good question. So there's, first of all, still a lot of research being done on these vaccines, and we're getting more information. Researchers are getting more information every single day about how effective they are, what they can prevent. But the things we do know with certainty about these vaccines are, for instance, with the Moderna and Pfizer vaccines, the ones that have been on the market the longest, is that they are extremely effective at preventing illness. So when they compared folks in the trial who got the vaccine to those who didn't, there was a 95%, 96% reduction in folks who had any symptoms at all, let alone really serious symptoms that would land them in the ICU or otherwise. So these vaccines seem to be incredibly effective at preventing symptoms. Now, whether they prevent you as a vaccinated individual from catching the virus and or transmitting it to other people, we frankly, scientists don't know entirely. There's some preliminary evidence that seems to suggest that yes, they may actually limit the spread of the virus itself, but there's not concrete evidence for that yet. I'm really excited because I think in the coming months we'll get more and more data about that. But at this point, they're extremely effective at preventing illness, symptomatic illness especially, let alone poor outcomes. So that's the primary reason why we're recommending that folks get them. In a kind of tangential way, they do protect other people in a couple different ways. The first way that you yourself getting vaccinated can help other people, the broader community, are some people, for a variety of reasons, are medically ineligible to get the vaccination. They may have other kind of contraindications to get the vaccination, what have you. And so by you yourself getting the vaccine, eventually over time, the more and more people that we have who get the vaccine shot, will achieve this concept called herd immunity, where there will be less and less of this virus prevalent in the general population. And so in a way, by getting the vaccine, not getting symptomatically ill to the point where you're spewing a whole bunch of this virus into the environment, you are in many ways actually helping the broader community. So could you still transmit it? Potentially, but I would gather that in a few months, we'll have even more data that show you may actually be helping prevent spread. We just don't know for certain. Really good question, so folks can get the infection a second time. Initially, scientists felt that was something that didn't happen. We now know that it can happen. There are also these additional strains of the virus which may allow for reinfection. So in many ways, even if you were to have had the actual virus, and that in and of itself may protect you a little bit from a future illness if you were to be re-exposed to the virus, the general recommendation from CDC and health authorities, is still to proceed with the vaccination, irrespective of whether or not you've actually had the virus, because it will further boost your immune system's ability to fight the virus were you to once again encounter it in the wild. I like this question because it really speaks to the ethics of these vaccine efforts. And I think folks who are asking themselves this question come from a really good place. They feel this empathy towards their fellow human man. They don't want to be immoral. They don't want to jump the line. They don't want to cut the line. They know that there are older folks, folks who may be less healthy, who would also benefit from the vaccine. What I've spoken to when I've spoken to folks about this particular question, what I say is there is a system whereby we are trying to be as orderly as possible in the distribution and allotment and equity of this vaccine. However, once your number is called, go and get the shot, because if you forego vaccine, there's no certainty that the person who may get the vaccine is any more or less eligible or needy. And again, going back to that earlier point, the only way that we will truly be able to emerge eventually from this pandemic is for the vast majority, 80–90% of the general population to get the vaccine. So while imperfect, at the end of the day, we want everybody to get the vaccine. So when your number's called, just go and get it. Yeah, so this kind of backs on other questions I've gotten from friends, neighbors, patients, employees, where they say this all seems so rushed. You know, we don't know the long-term safety. We don't know the long-term data about these vaccines. Is it in 5–10 years going to be something that will then pop up with something concerning? One of the things that these questions don't recognize is that mRNA vaccines have actually been in study in a variety of different forms for about a dozen years, 12–13 years. The first mRNA vaccines have been in extensive animal studies, in some preliminary small human studies. This is the first time it's been disseminated to such a large, broad population, but we have long-term safety data for these types of vaccines that don't show any terms of significant long-term side effects. So in many ways, you know, I think that it's a very safe vaccine. I was so eager to get it. My family is eager to get it as well, though they have yet to be able to get it. And I, even for my own family, don't have long-term concerns about side effects based off of that longitudinal data that we have in similar vaccines that have been studied for some time now. There's no evidence of that in the trial data, nor in, you know, the population studies that are happening to date. These are awful things to talk about or consider, but in the trial studies there were some miscarriages. However, they all occurred in the placebo groups. So in these studies where they were having and tracking, you know, rates of miscarriage or what have you, those miscarriages did not occur in the folks who actually got the vaccine. They occurred in folks who were getting the inert placebo. And in terms of long-term safety or long-term fertility, I think it's useful to explore what the data is currently suggesting in terms of safety in women who are actively pregnant. There's a lot of, you know, research being done on this, but increasingly we're finding more and more organizations, including the Maternal Fetal Medicine Society, advocating women who are pregnant to get the vaccination. And again, there doesn't seem to be any long-term effects on fertility. So while I can understand the concern in a healthy young person that raises that question, we simply don't have data that would suggest that it would have any impact on a current pregnancy or long-term fertility. Without getting too preachy or too, you know, high on my soapbox here, you know, if you're listening to this video, you're joining a healthcare organization, you're joining Dermatology Consultants, you are an employee with this organization. And in many ways, as a healthcare worker, I think people look up to you, to us, to set an example for what they themselves may do, you know, our friends, our neighbors, our family. And I think this is really, it's a time when we can step forward and for the better good, advocate for this genuinely safe, effective vaccine. I think that you carry this additional moral authority, and if we can set that good precedent, together we will be able to emerge from this terrible pandemic. But it will take a concerted national and international effort, and we need to do our part in much the same way that, you know, historically the last time I called upon as a nation to do something like this was truly the polio epidemic, where you had mass vaccination, and there polio rampant community. The reason we don't have children in iron lungs and all these dreadful sequelae is because of those mass vaccination efforts. I look at this as analogous. This is our time to use science for the better good. We should do our part in advocating that.